Your hands are tingling right now. Your feet feel like they're on fire. You drop things without meaning to. And your doctor says it's just aging. But what if I told you one vitamin, just one, could start reversing that damage in 14 days? I'm Dr. David Chen. And today, I'm revealing the nerve repair protocol Big Pharma doesn't want you to know about. Stay with me, because what I'm about to show you could save your independence. Let me be direct. If you're over 60 and experiencing numbness, tingling, or burning in your hands and feet, you're not alone. Over 20 million Americans suffer from peripheral neuropathy. Most are told there's no cure. Most are handed prescriptions that mask symptoms, but never fix the problem. But here's what shocked me after 30 years in medicine. Your nerves can regenerate. Your body can repair the damage, but only if you give it the right raw materials. And there's one vitamin that does this better than anything else. Before we dive in, do me a favor. Comment below with your age and your main nerve symptom. Are you dealing with burning feet, numb hands, balance issues? I read every comment. And hit that subscribe button, because this channel exists to give you the truth your doctor doesn't have time to explain. Now, let's talk about what's really happening inside your body. Your nerves are like electrical wires. They carry signals from your brain to every part of your body. But these wires need insulation. That insulation is called the myelin sheath. After 60, this protective coating starts breaking down. Why? 3 reasons. First, your stomach acid decreases. You can't extract vitamins from food like you used to. Even if you eat well, your body isn't absorbing the nutrients. Second, medications are stealing your vitamins. Blood pressure meds, diabetes drugs, acid blockers. They all deplete critical nutrients. You're taking pills to stay alive, but those same pills are starving your nerves. Third, chronic inflammation. Years of poor diet, stress, and toxins have created a low-grade fire in your body. This inflammation attacks your nerve coating like acid on metal. The result? Exposed nerves, misfiring signals, pain, numbness, and loss of function. Let me describe what you're feeling. Burning feet that keep you awake at night. Tingling hands that make buttoning a shirt impossible. Numbness that makes you afraid to drive. Weakness that forces you to hold on to walls. Dizziness and balance problems. The fear of falling. The fear of losing your independence. Sound familiar? Here's what most doctors won't tell you. This isn't just aging. This is a deficiency, a specific fixable deficiency. And once you correct it, your body can start healing. The vitamin is B1. But not just any B1. I'm talking about a specific form called Benfotiamine. Here's why this matters. Regular vitamin B1, thiamine, is water-soluble. It dissolves in water, but your nerve cells are made of fat. Water and fat don't mix. So regular B1 can't penetrate your nerve tissue. It just passes through your system and gets flushed out. Benfotiamine is different. It's fat-soluble. It soaks directly into your nerve cells. It crosses the blood-nerve barrier. It gets to work immediately. Here's what happens when you take it. Week 1. Benfotiamine enters your bloodstream, travels to damaged nerve sites, and begins reducing inflammation. You might feel increased tingling. This is good. It means nerves are waking up. Week 2. The myelin sheath starts rebuilding. Nerve signals become clearer. Pain begins to decrease. Sensation starts returning. Weeks 3 and 4. Significant improvement in symptoms. Better balance and coordination. Reduced burning and numbness. Improved sleep quality. And the science backs this up. A study in the journal Diabetes Care showed patients taking 600 milligrams of benfotiamine daily experienced a 50% reduction in nerve pain, improved nerve conduction velocity, and better quality of life scores. Another study in experimental and clinical endocrinology and diabetes found benfotiamine reduced markers of nerve damage by 40% in just 6 weeks. This isn't theory. This is documented, peer-reviewed science. So why hasn't your doctor told you about this? Here's the uncomfortable truth. There's no money in vitamins. Pharmaceutical companies can't patent benfotiamine. They make billions on nerve pain medications like gabapentin and Lyrica. These drugs don't fix anything. They just numb your brain so you don't feel the pain. Meanwhile, your nerves continue dying. Benfotiamine actually repairs the damage. But there's no profit in healing you. For nerve repair, you need 300 to 600 milligrams of benfotiamine daily. Not 50 milligrams. Not 100 milligrams. The therapeutic dose is 300 to 600 milligrams. Most store-bought supplements are too weak. You need pharmaceutical-grade benfotiamine. And this is critical. Take it with fat. Because it's fat-soluble, you must take it with a meal containing healthy fats. Eggs, avocado, nuts, olive oil. Without fat, your body can't absorb it. Take it in the morning with breakfast. B vitamins provide energy, and taking them at night can disrupt your sleep. Morning dosing gives you steady nerve support all day. Now, benfotiamine alone isn't enough. To maximize nerve repair, you need supporting nutrients. Here's the full nerve repair stack. Number 1, benfotiamine, 300 to 600 milligrams. The foundation. Rebuilds the myelin sheath and reduces inflammation. Number 2, methylcobalamin B12, 1,000 micrograms. Supports nerve regeneration and protects nerve structure. Must be methylcobalamin, not cyanocobalamin. Number 3, alpha-lipoic acid, 600 milligrams, a powerful antioxidant that reduces oxidative stress in nerves and improves blood flow to nerve tissue. Number 4, magnesium glycinate, 400 milligrams, calms nerve firing, reduces muscle cramps, and improves sleep. Number 5, vitamin D3, 5,000 IU, reduces inflammation, supports nerve health. Most seniors are deficient. Take these in the morning with breakfast. Benfotiamine, B12, alpha-lipoic acid, and vitamin D3. Take magnesium glycinate in the evening with dinner. Your diet matters too. Focus on healthy fats, wild-caught salmon, avocados, walnuts, olive oil, B vitamin-rich foods, eggs, grass-fed beef, nutritional yeast, leafy greens, anti-inflammatory foods, berries, turmeric, ginger, green tea. And avoid sugar. It's toxic to nerves. Avoid processed foods. They increase inflammation. Avoid alcohol. It depletes B vitamins. And avoid trans fats. They damage nerve membranes. A few lifestyle factors to keep in mind. Exercise. Gentle walking increases blood flow to nerves. Aim for 20 to 30 minutes daily. Don't overdo it. Sleep. Nerves repair during deep sleep. Aim for 7 to 8 hours. Keep your room cool and dark. Stress management. Chronic stress depletes B vitamins. Practice deep breathing. Consider meditation. Here's what to expect on the timeline. Days 1 through 7. You might feel nothing, or you might feel more tingling. Both are normal. Nerves are activating. Days 8 through 14. Burning sensation starts decreasing. Sleep improves. Energy increases. Weeks 3 and 4. Noticeable reduction in numbness. Better balance. Improved hand coordination. Months 2 and 3. Significant symptom improvement. Many people reduce or eliminate pain medications. Quality of life dramatically improves. Let me share some patient stories. Margaret, age 68. Diabetic neuropathy for 5 years. Couldn't sleep due to burning feet. After 3 weeks on benfotiamine, 70% pain reduction. After 3 months, off gabapentin completely. Robert, age 72, numbness in hands from chemotherapy. Couldn't button his shirt. After 2 weeks, started feeling his fingers again. After 6 weeks, full dexterity restored. Linda, age 65. Balance issues and frequent falls. Afraid to leave the house. After 1 month, balance improved significantly. After 3 months, walking confidently again. These aren't miracles. This is what happens when you give your body what it needs. Now, some important safety information. Benfotiamine is extremely safe. But here's what you need to know. If you're on blood thinners, consult your doctor first. B vitamins can interact with warfarin. If you have kidney disease, Start with lower doses and monitor with your physician. If you're on diabetes medication, benfotiamine may lower blood sugar. Your medication may need adjustment. This is a good thing, but it needs monitoring. Let me also cover common mistakes to avoid. Mistake 1. Buying cheap B1. Regular thiamine won't work. You must get benfotiamine. Check the label carefully. Mistake 2. Taking too little. 50 milligrams won't do anything. You need 300 to 600 milligrams for therapeutic effect. Mistake 3. Taking it without fat. It won't absorb. Always take with a fatty meal. Mistake 4. Expecting overnight results. Nerve repair takes time. Give it at least 2 to 4 weeks. Don't give up too soon. Mistake 5. Not addressing the root cause. If medications are depleting B1, you need higher doses. If blood sugar is high, you must control it. Fix the underlying problem. And please, seek immediate medical attention if you experience sudden severe weakness, loss of bladder or bowel control, severe pain that doesn't improve, or symptoms that are rapidly worsening. These could indicate serious conditions requiring urgent care. One more thing. Can you take too much? Benfotiamine is water-soluble. Excess is excreted in urine. There is no known toxicity. Even at 1,200 milligrams, it's considered safe. But more isn't always better. 600 milligrams is the sweet spot for most people. Let's bring this together. Your nerves are damaged, but they're not dead. They can heal. They can regenerate, but only if you give them the right tools. Benfotiamine is that tool. It's not a drug. It's not a gimmick. It's a fat-soluble form of vitamin B, one that actually penetrates nerve tissue. Here's your quick recap. Morning, 300 to 600 milligrams. Benfotiamine, 1,000 micrograms. Methylcobalamin, B12, 600 milligrams. Alpha-lipoic acid, 5,000 IU vitamin D3. Take with a fatty breakfast. Evening, 400 milligrams. Magnesium glycinate. Take with dinner. Lifestyle, eliminate sugar, eat anti-inflammatory foods, walk daily, sleep 7 to 8 hours, manage stress. Timeline, weeks 1 and 2, initial changes, and possible increased tingling. Weeks 3 and 4, noticeable symptom reduction. Months 2 and 3, significant improvement. Here's your action plan for today. Step 1. Order pharmaceutical-grade benfotiamine. Look for 300 milligram capsules from reputable sources. Step 2. Get the supporting nutrients. Methylcobalamin B12, alpha-lipoic acid, magnesium glycinate, and vitamin D3. Step 3. Clean up your diet. Remove sugar and processed foods. Add healthy fats. Increase anti-inflammatory foods. Step 4. Start tomorrow morning. Take with a fatty breakfast. Be consistent. Track your symptoms. Step 5. Give it time. Nerves heal slowly. Stay committed for at least 8 weeks. You don't have to live with nerve pain. You don't have to accept numbness as just aging. You don't have to lose your independence. Your body wants to heal. It's designed to heal. You just need to give it the right raw materials. Benfotiamine is that material, and the science is clear. It works. Before you go, I need to hear from you. Comment below and tell me, what's your main nerve symptom? How long have you been dealing with it? And are you going to try benfotiamine? Your story matters, and it might help someone else watching this video. If this information helped you, hit that like button. Share this video with someone who needs it, and subscribe to this channel because I'm here to give you the truth. The science-backed protocols that actually work, not the watered-down advice that keeps you sick. Next week, I'm revealing the one exercise that rebuilds balance in seniors. It takes 5 minutes a day, and it could prevent your next fall. You won't want to miss it. I'm Dr. David Chen. Thank you for trusting me with your health. Now go take action. Your nerves are waiting to heal.